See, you cannot survive without microbes completely because you need them in your mouth for cleansing your mouth, you need them in your gut for digestion. So some microbes are essential for your survival. You have certain things which are endemic and they are epidemic. When say endemic, you have it in your place. It will differ from place to place. What I have in Chennai may not be the same in Delhi and it may not be the same in New York. Go down south or 300 kilometers from Chennai. You will still see people suffering from rat fever and becoming very sick. Like as I said, hand washing. So hand washing is one common thing which we ask people to do before and after eating food. Simply because you carry a lot of germs in your hands. Youngsters. I'm talking about youngsters, school going, college going, or early adulthood people. They are the ones who are going early. They will catch up some virus. For them, it will be really mild. They come home, give it to the elderly people. These people become sick. October, November, December, January, our heart attack stroke rates also high. It's the youngsters who come in. So we keep telling the youngsters during the season, especially if you have vulnerable people at home, follow reverse barrier.
Every outbreak has a story, and every infection leaves clues. Our guest today is someone who pieces these puzzles together like a true detective. Dr. Vijayalakshmi Balakrishnan, a renowned infectious disease expert and a popular voice on Instagram, is here with us to discuss on our podcast Health for You. I am Chetna Belgare. Let's welcome the guest. Welcome, ma'am.
Welcome.
Ma'am, my first question to all guests is, what if you were not a doctor? What would you have been?
Very likely a teacher.
Okay, that's interesting. Ma'am, why infectious diseases? I mean, this is a area which is, very, very important, definitely. But what took you to that stream?
Well, the way it goes is during our MD days, I did my master's at Madras Medical College. At the time, we really didn't have quite a good armamentarium with regards to microbiology, and a lot of things were empirical. So when I finished MD, I felt ill-equipped with regards to infectious diseases because I wanted to be a good physician, but I felt that I didn't know enough about infectious diseases, which probably was a basic. See, when you talk about survival across, let's say, humanity has grown this much because of two reasons. One is mainly vaccination and sanitation.
Right.
And if you look at the hospital setup, what saves most lives? It's not your CBC, ABGs or complex surgeries. It is good infection control.
Right.
So for me, infectious diseases forms the basis for everything. So when I finished MD, I felt I was ill-equipped. So I went to CMC Venlo. I asking them for a brief stay to understand infectious diseases. And luck, I would say it's rather a luck. At that time, they were looking for consultants. So I straight away joined as a consultant in infectious diseases after MD. Okay. I was there for 2 years. So working in the Department of Infectious Diseases and learning infectious disease simultaneously. At that time, we didn't have post-graduation ID. So, and after that, yes, I fell in love with ID and then moved into it because during my MD days, everybody would have thought I'll be either a critical care physician or cardiologist. That was what I was doing a lot.
Mm-hmm.
But ID happened, that 2-year stint in CMC tilted everything. Okay. Then I came back to Chennai, went to Pondicherry, went to UK, been ID throughout.
That's very interesting, ma'am. Well, first to our listeners and viewers, what do you define, when you talk about in simple terms, how do you define infectious diseases?
So when somebody asks me what infectious diseases, it's like, say, we have cells on our body and we have 10 times more organisms living on us compared to the cells. Let's say looking into the gut, skin, everywhere. So there are microbes everywhere. And we live in a world which is actually theirs. And as we survive, as we evolve to survive, they also evolve to survive. So there will be a constant interaction with them, which at times is beneficial. For example, your gut bacteria helps you to ferment and digest food. That time it can cause a lot of death and damage. So this balance has to be maintained. Infectious diseases is making sure that the infections or all these bugs do not damage you. At the same time, you have enough amount of good infectious organism to sustain you. Quite balancing act. Your survival also depends upon their survival also depends upon your survival. You have to live in heart. Maintaining that balance is what is going to prolong our survival.
Okay. I mean, that's quite interesting yet curious for me because, when COVID happened, a lot of us were, we're supposed to be wearing your masks, then you're supposed to sanitize yourself. You're saying there is microbes everywhere, right? So now, is there a world at all where you really can do away with those germs? Is it something which you can do? Should you do? What is it that, and how do they actually enter your body?
So first of all, you cannot live without microbes because you need microbes to live. Let's say you're having a bone marrow transplant where they take away your bone marrow. Bone marrow is what produces your cells. Even in them, there will be some gut microbes because here you're irradiating. Sometimes you irradiate the whole body to kill everything, decrease the number of bugs. See, you cannot survive without microbes completely because you need them in your mouth for cleansing your mouth. You need them in your gut for digestion. So some microbes are essential for your survival. And they also require you for survival because they can only survive on. Even the complicated infections, they need human interaction for survival. Once you die off, the bug also dies. So interaction is that way only. So when we talk about sanitizing, basically we want to ensure that good bacteria is already there. Bad bacteria do not enter in and cause a problem. Let's take a simple example of typhoid fever. Typhoid fever is endemic throughout India. We see it throughout the year. It is not even confined to some point of time. So in typhoid fever, what happens? People develop fever and everybody assumes that it is something which comes as such. It is basically foodborne disease. Somebody has typhoid fever. They pass a germ through their gut, that is their motions, and it contaminates their hands. That enters into the food chain from their hands or through water contamination. And you eat it and you develop it. It's a very simple process. So you eat the bacteria, and once it passes the defenses, you have a lot of defenses in your mouth, in your throat, in your belly. Once it passes the defenses only, it enters into the blood. Then it can cause an infection. Then it causes an infection. For salmonella to survive, it also needs to be in somebody. It also needs to survive in the environment. And we have good bacteria that this salmonella has to cross that to produce an infection. So we sanitize to prevent these kind of bugs going in.
Okay.
Your basic sanitation is avoiding these virulent bugs. When we say virulent, these cause more damage.
Okay.
That which can cause an infection of an organ or a death. So you don't want those bugs going in. That's why you sanitize.
Okay. So are there, when you're looking at your clinical experience, are there any, you say that these are the most common infections that you see in your clinical experience these days?
See, as you say, you have certain things which are endemic and they are epidemic. When say endemic, you have it in your place. It will differ from place to place. What I have in Chennai may not be the same in Delhi and it may not be the same in New York. So these endemic bugs are specific to that point. I'll give you a small example. Rat fever, leptospirosis. When 20 years back, during my PG days and UG days, we used to see really bad rat fevers. Now, if I do the serology testing of all people in Chennai, a lot of them will be positive. We don't see bad rat fevers. Go down south or 300 kilometers from Chennai, you will still see people suffering from rat fever and becoming very sick.
Okay.
So that is a change in epidemiology. But then a lot of things change. In Chennai, if you say the moment July, August comes, you'll definitely see dengue. So this may not be the same in some other place. So these are endemic. So we know in wherever we are that we will see certain infection during certain period of time. Okay. So the common tropical fevers we see. Apart from that, these seasonal infections which come as epidemics, like your swine flu epidemic, your corona epidemic. So every year during the month of August, September, sometimes we can see it. You all usually see a flu influenza. Sometimes it may be more than that. Then it becomes an epidemic. That or other things you see. So commonly, the community-acquired infections, all these food and waterborne, respiratory infections, those are the common things. We see pneumonia, UTIs. This is from the community. We also see uncommon things because we come under the light specialty.
I mean, my next question is, you were talking about how there are seasonal, of course, we all see that there are seasonal infections and then epidemic infections, and then it differs from region to region as well. If I look at, there are some infections which are because of everyday mistakes that people do. So if you could break down into what are those infections which people catch because
everyday mistakes. Like as I said, hand washing. So hand washing is one common thing which we ask people to do before and after eating food. Simply because you carry a lot of germs in your hands, especially if you're exposed to a food and beverage industry or hospitality industry or hospital industry. Obviously, you're exposed to more germs. And when you eat without washing your hands and the pathogen load is extremely high, you are bound to be sick. Second, one common thing which we see during this season is you'll have elderly people at home and you'll have youngsters. I'm talking about youngsters, school going, college going, or early adulthood people. They are the ones who are going early. They will catch up some virus. For them, it will be really mild. They come home, give it to the elderly people. These people become sick. They come to us either with a flu or they come to us with heart attack and strokes. So throughout these like I'm talking about October, November, December, January, our heart attack stroke rates also high. Simply because all these viral infections precipitate a vascular crisis. And you will see them all in elderly. But when you ask them, they'll always say the same thing. We hardly go out. We are very meticulous. No, it's not you. It's the youngsters who come in. So we keep telling the youngsters during the season, especially if you have vulnerable people at home, follow reverse barrier. That means when you come home, if you're completely fine, wash your hands, wash your face, you're completely fine, have a close interaction with the vulnerable. If you are not sure, don't meet them. Let them be in a separate room, you be in a separate room. In fact, the entire COVID epidemic kind of phased through this group only. And this is pretty common.
Yes, that's right. That's right. Ma'am, what about food? Like, when they eat food outside or, when they cook food, is there anything that they need to be very, very careful about? Because a lot of us, especially in India with the, there are probably food outlets more than your offices and, other spaces now. So considering this scenario, is there something which people need to be very careful about? One, while they're eating outside. Second, while they're cooking in their own homes.
So eating outside any reheated food, unless the temperature becomes really high, you can still harbor some bacteria. Especially a lot of these spore-forming organisms can just stay unless it's kind of roll boiled. They do not die. So they enter into your gut and then they germinate and cause problems. Small example is the Bacillus cereus. So you go to a fast food restaurant, a noodles or a fried rice restaurant. What happens? They have these chicken separately, noodles separately. They mix very fast and give it to you. So a lot of times the temperature may not reach inside the meat. And if it is infected, when the high temperature is not being disposed, do not give it. So after 6 hours, maybe 3 hours, 6 hours, you start vomiting. You get belly pain. Sometimes you can have fever. This kind of food poisoning happens. The food does not cook properly. So when you go to these fast food restaurants, there's always a problem. So any food which is freshly prepared is much more safer than reheated food. And always be careful about these quick fixes. Because see what happens, they use the high temperature and the shortest duration possible. Obviously, the chance of contamination is extremely high. Nobody is saying that avoid food completely, but make sure to be careful.
Okay.
And be very careful because it's often very difficult. Because if that's the only source and that's the only thing you like, people can't do anything. Even if it's going to be a dosa chapati made in front of you, in a small outlet, it's probably safer than a reheated or a freshly prepared noodles or reheated biryani at a 5-star hotel. So the idea is if they prepare it at a required temperature for a duration required, food is generally good. And if you're vulnerable, avoid taking salads and chutneys and rasams outside because they are not boiled. So unboiled food, avoid when you go out. Similarly, you have this new thing coming up, these milk products, rose milks, badam milks. You see them cutting the packet, milkshakes, and then directly putting it on. If it's a pasteurized milk, fine. If it is not, again, it can create problems.
Okay, okay. What about cooking at home, ma'am? Is there certain temperature that we need to be careful about? Because, in earlier days, we were used to people cooking at a certain temperature for a longer time. Now, like you said, similar thing at like fast food joints may not be so fast, but even at homes, there are microwaves and things that we use. So, is there something that people need to be worried about or take care of?
Yeah. Microwaves, cooking, everything is fine. As long as it's cooked well.
Okay.
So remember, if it's going to be water and milk, roll boil it for 3 minutes. So the age-old habit of, boiling water in the morning. So it's not just warming up the water and drinking it. Warming up the water may not be enough. It has to roll boil. So if you don't have a good filter, if you don't have access to a good filter, just roll boil it. Once it starts boiling, just measure for 3 minutes, and then it's safe to drink throughout the day. But don't retain the same water for a week or so. It doesn't help. Every day you do it, that really is going to help. Same with milk. Roll boil for 3 minutes. You're going to reheat food from fridge. Make sure it's completely heated. For example, microwaving, it's a very good modality. Retains the nutrients fine. But sometimes the central part may not have cooked. Make sure it's uniformly cooked before you eat.
Okay.
And if you're going to have fruits and vegetables, wash them, peel them, have it.
What about sprouts? I've heard a lot about, people eating sprouts and that leading to infections as well. Because sprouts is generally considered as healthy and people generally tend to mix it in all salads. So is there anything that they need to be very careful about?
Fortunately, we really don't have much of a problem with certain helminthic infections down south. But we do get people from Eastern India coming up. So certain helminths can grow in these kind of green vegetables. And you must have heard of cysticercosis. Again, that's something which can come in. Generally, as long as you wash them well and sprout them and take it, should not be a problem. But if you're in an area where infestation is fine, and if you're vulnerable, I'm talking about vulnerable. Somebody's had a transplant, a major cardiac surgery or neurosurgery, somebody's on steroids, any immunosuppressive agents. We tell them to be careful for the next 3 months. For them, we ask them to boil anything and everything.
Okay.
Once it's cooked well, it becomes safer.
Okay.
So on the whole, I don't think we need to panic much. Regular washing and sprouting should be fine. But if you have somebody who's in the high risk group, probably you can make boil it and make a sundal out of it and give it to them.
Okay.
And when you do slow cooking, most of the nutrition is retained.
Yeah, right. Ma'am, are there any infections right now in this month that city dwellers? I'm talking about, I understand that it is different from each region, but still considering that, at least in the south, down south, where we're looking at majority of the cities like metros especially. So are there some infections which you think that they must be concerned about right now starting from September onwards?
So it's a dengue season. So if you have, just make sure you go around your house, empty all these water storage bins. Look at areas behind your refrigerators, your AC ground. If there's an area where there is a water stagnation, scrub it clean and dry it. Make sure you do it on a weekly basis, because dengue mosquito, government cannot do much unless you do it, because it's going to be staying with you in and around your house. So spraying everywhere is difficult, and indoor spraying hardly happens in the cities. So unless we make sure water doesn't stagnate, dengue is going to be with us. And if somebody has a dengue, make sure they drink a lot of fluids and avoid all these kashayams and things, which probably comes in with more harm than any benefit. Second is flu season. This is a flu season. Get yourself vaccinated. This year in South, especially Tamil Nadu and Bangalore, season has started a bit early. People are falling sick with flu early itself. Generally, it starts from mid-September, but we started seeing cases from mid-August per se. So vaccinate yourself if you have not. If you have milder symptoms, isolate yourself. Don't go to work. At least take 5 days off till your symptoms are completely fine before you go. You might not become sick, but you might give it to somebody who might become really sick and land up in an ICU.
So, when you spoke about vaccination, actually, I had that question towards the end of my conversation, but I might ask you now itself. In India, especially, people believe that vaccination is only for children, and many of them do not take vaccination once they're adults. How important does adult vaccine actually become in this scenario, ma'am?
My ICU is full, and 50% of them are people in their 50s, 60s, and 70s presenting with either a pneumonia or a breathing difficulty, heart attack, or stroke. It's like it seems to be literally homogeneous. These are all people who have developed an influenza-like illness, and either developed pneumonia because of that, or their lungs has become bad, or heart or brain has become bad. And imagine all those admissions could be just avoided with a simple shot. So you have to understand it is not just pneumonia. When in the vulnerable group, this pneumonia precipitates a cascade. Even if you don't develop a pneumonia, you can have other problems too. So vaccination, especially flu vaccination, is seasonally, and also pneumococcal vaccine if you're diabetic also. definitely saves lives. Make sure you take it. And this is the time. Somebody in the family would have had some flu or who understand what's going through. Get it now.
Ma'am, other than these two vaccines, there is also, herpes, which is kind of, I hear a lot of people now saying that, I got chicken pox, then herpes. So is it the same virus? Do they have to take vaccines for that? Does the caretaker have to take a vaccine for that? What is the scenario around herpes itself? Because I think from even probably my age or the previous generation, they did not have chickenpox vaccine under the government. We were not given. We naturally got chickenpox.
Never there during the government scheme. Only thing is, still probably 15 years back, people were getting chickenpox in their childhood and they were protected. Now
Right.
there is a group of people who didn't get chickenpox in childhood and they're developing it adult. Remember, chickenpox is not herpes, it is varicella. It's otherwise called as herpes zoster. So, when somebody develops chickenpox, this virus settles down in the nerves in your body. And as we become older or when the immunity goes down, it comes as an eruption in some part of the body, and that is called as varicella zoster, herpes zoster. So, you're vaccinated both for chickenpox and for zoster. So, chickenpox vaccine is taken for people who has never had chickenpox. That prevents you from developing chickenpox. See, we don't try to give it for very small children because children don't develop major complications. But once you cross 10 years and you've not had chickenpox, I suggest they get vaccinated. If you've had chickenpox in childhood, you're aging, you're having diabetes, you're having asthma, you have a cardiac problem, then zoster vaccine definitely helps. So anybody above 50 years or 65 years, especially with some other problems, zoster vaccine is indicated. The reason you take zoster vaccine is this vaccine decreases herpes zoster. Herpes zoster has, yes, some complications. Some people become sick. But majority, it's very painful. Often it is kind of like a heart attack pain. So severe. Sometimes other complications get missed too. So elderly people taking a herpes zoster vaccine prevents a lot of problems. Okay. So if not had chickenpox, you go for chickenpox vaccine. If you've had chickenpox and you're very old, take herpes zoster vaccine.
Okay. What if somebody has forgotten whether they've taken the vaccine, if they've got chickenpox or not? Can they still go ahead and take it?
We do something called VZV IgG antibody testing.
Okay.
And if it is positive, we go for zoster.
Okay, right.
Zoster vaccine.
Okay.
And I should add typhoid vaccine with this. It's a very safe vaccine, low cost, and it's something which all of us should take because it's still endemic for typhoid. It protects you reasonably well. So all of you take a typhoid shot.
Okay. Ma'am, my, coming to some serious questions on some issues like brain infections, because, we always thought brain infection is something quite rare and it was not very often heard about. But now we are seeing a lot of cases, especially even in Kerala. Now, recently we had, we've almost 6 deaths now in this year. So, what is actually happening? Is there something changing? Is it the climate or is it always been there? And then what is the scenario around that especially?
So brain infection is called as meningitis.
Yes.
So it can be two ways. Either you inhale a pathogen which enters directly into the brain and causes it, or from the bloodstream and goes up. So we always be seeing brain infections. Like for example, post-flu season, pneumococci can present with meningitis. That's why now we are vaccinating the children against pneumococci. It used to be pneumococci and H influenza. They used to be a very common cause of meningitis in children and young adults for quite a long time. Now with the vaccination going up in a big way, it has come down. Then we have something called meningococci, which commonly cause meningitis. We don't see much in South, but there is a belt in North India from Delhi to Eastern India where they do get meningococci. Africa, they regularly get it every year. So these amoebic meningoencephalitis are all relatively rare because when they have bath in the water, these amoeba directly enters into the brain and produces it. So it's more like your inhalation mode entering it. It's seen in some kind of clean water, and the exposure is much more in Kerala compared to us because after we all became urbanized, we hardly have access to the natural environment. So Kerala, two reasons. One, exposure is there and people are picking it up. So most of the places, it's not diagnosed, so it's not picked up.
Okay.
And we do get meningitis and encephalitis as small epidemics. So sometimes you have hantavirus or those things happen. Every year you will have it in some pockets across India. So I would say it's not rare, but say the age group is usually young, and it's not much reported and talked about in the cities. You see it more in the semi-urban zones, and semi-urban zones do not come up that much on the radar. That's probably why we don't talk much about it.
Okay, okay. So is there anything like a precaution that people traveling from one place to another place, especially when they're venturing out in waterfalls or ponds or those places, should be a little careful about? Is there anything that they could do?
See, very difficult to say because see, these are not really brackish water or difficult water to say. See, those are amoebic encephalitis are relatively rare. We talk about common ones. If you're going to a place where there's an epidemic on, for example, mid-zone of Africa, then we take up meningitis vaccine. Some areas in US, when children go to study, we give them meningitis vaccine. Some zones in Delhi and Delhi, Nepal border, some part of Manipur, we give them meningitis vaccine. We know because it's there. Other zones are hardly needed. So Jap encephalitis, we had some. So some people going to peripheries or jungle area, we give. So it is more selective than giving everybody.
Okay, okay.
So, and it all depends upon what is there in the environment.
Okay. I'm talking about environment, climate change is something that is being most spoken about. And, we are also seeing rising temperatures and monsoons. It's like a perfect storm for infections. So should people in South India, especially, be more cautious about water, seasonal activities? Like how is the climate change actually impacting the growth of these kind of infections?
Lots of infections are changing quite a bit with climate change. See, what we used to see a lot of malaria. We hardly see malaria now in Chennai.
Yeah.
Dengue is there almost like 3/4 of the year, which used to be unusual. So you start seeing a different presentation of different bugs. The incubation period changes a lot. New infections come up. For example, chikungunya, we saw it 2005, 2006. We didn't have much. Again, we are seeing a rise this year. So depending upon these things, a lot of changes coming. See, we are seeing that gut infestation has changes, some kind of parasitic meningoencephalitis. Even your amoebic meningoencephalitis can have your relation with your environmental change. See, first is climate change. Second, we encroaching into the forest and directly landing up in their environment. So we are going to have new infections. If you ask me whether there's a single solution to prevent it, I don't think it is possible. It's too big a thing for us to decide based upon something. If you have a focal epidemic somewhere, then we can probably think about a guideline for that. But I don't think we'll be able to generalize anything. For example, mucor. We did have a huge mucor wave post-COVID. And every year, seasonally, we see mucor.
Right.
And then you don't see it at all. And it seems to be more nowadays. It used to be in the rural zone. Now we're seeing it in the urban zone. And whether it's got any connection with the climate, we can't be sure. And if you have floods, immediately we'll see a surge in milioidosis. So it depends. And it's all whatever guidelines you give at that particular moment.
Mm-hmm. What about this re-emerging of infections, ma'am? We're seeing that, like you said, there are so many infections that link. So this whole thing about antibiotic resistance, is it just like a medical jargon? Because there's so much of discussion around it, but very little actually happening on the ground where people are stopping to, even prescribe an antibiotic or just popping it like that. So how serious this issue is?
Antibiotic resistance is spoken about quite a lot. WHO is very much it. One health initiative has been launched. So everybody is working on. In fact, Kerala, you cannot buy antibiotic without a prescription.
Right.
But take my word, every day.
Absolutely.
Yeah. Every day I see people coming to my OPD with a flu-like syndrome already on antibiotics. They'll say, I had some meeting coming in, I had a wedding, I had to travel somewhere, so I didn't want to take a risk. I popped up antibiotic for 2-3 days, and then they land up with it. So it is like people start doing it, and that is one part of it. Second comes, as we go for tertiary and quaternary care, antibiotic usage becomes more. When antibiotic usage becomes more, resistance also increases. So every hospital should have some amount of antibiotic stewardship. When I say stewardship, starting the right antibiotic at the right time, using it for the right duration, and stopping it when it is needed to be stopped. Don't overshoot it, don't underkill it. Use it appropriately. And doing that decreases the resistance to a significant extent. See, emergence of resistance is bound to happen because the bugs also have to survive like you want to survive. And we will also have to find out new antibiotics, new ways of handling them, better infection control. That is also bound to happen.
Right. Yeah, I agree, ma'am. Ma'am, I have though I had a lot of other questions, I think we're really pressed for time. So I'll have to ask you one last question. If you had a single message for our listeners to stay infection free, what would it be?
I would say in this season, vaccinate yourself. Take your flu shot, take your pneumococcal shot, take your typhoid shot. If you have not had hepatitis B shot, take it. Because vaccination really helps. Humanity has rose to this amount just because of pediatric vaccination. As adults, we also have the responsibility to do it. And make sure that we live with good hygiene.
Thank you very much, ma'am. It was wonderful having you on the show. Thanks a lot.
Pleasure, Slay. Thank you.
Thank you. That is all we have for this week. Thank you for watching.